Good morning. Welcome to Getting There. This series is by ATSU University, designed to speak to our audience about ways in which you can become a healthcare professional. Getting There is a comprehensive look at those ways through the eyes of those persons who've already been there. Also, it's an opportunity to discuss ATSU University's initiative of cultural proficiency, which is a way of behaving that allows you to respond appropriately in different cultural settings. One of the things that is often asked when I go out to career fairs about how to become a doctor, dentist, or other allied health profession is, where is ATSU University? I've never heard of it. ATSU University is the founding institution of osteopathic medicine. ATSU University was founded by Dr. Andrew Taylor Steele in 1892 in Kirksville, Missouri. We are one university with 6 schools. These schools provide excellent education for inspiring individuals who want to be the light of hope that they see in the world, that's needed in the world. As such, today we will speak with Dr. Gwenlynn Multine, who is a graduate of ASDO. She graduated in 2008.
Correct.
And is currently working in our community with Indian Health Services and also serves on our National Center for American Indian Health Professions. So, Dr. Multine, thank you for being here with us today.
Thank you for inviting me.
Okay. We look forward to learning more about your experiences in pursuing the field of dentistry and how you came to be who you are in this really profound career choice.
Right.
So first, I would like for our audience to learn a little bit more about who you actually are. So tell us in a couple of seconds or a minute or two who you are and your background and your experience.
Okay. I am of Navajo heritage. I grew up on the reservation in Tuba City, Arizona, which is in northern Arizona. I came down to Phoenix, Arizona to go to college for my undergraduate degree and subsequently went to dental school and stuff like that. I have a daughter, she's 16 now, and currently work at the Indian Health Services. I've been there since I've been out of dental school and on the Salt River Reservation here in Scottsdale, Arizona.
Well, that's fantastic. You have a daughter that's 16 years old.
Yes.
I speak to young people all the time, many of whom are that very age, 16.
Yes.
Many of whom are, in some cases, contemplating a career, and almost always, especially when we talk about populations of color, and more specifically the American Indian population, those young people don't really see themselves as becoming a dentist. So what would you say to someone in that position who's never contemplated the field of dentistry?
You know, it's hard to talk to a 16-year-old about making a big decision, like what are you going to do for the rest of your life. My daughter's herself struggling with this same topic and same interest, and trying to figure out what it is she wants to do and how she will live her life and serve out, what it is she chooses to do. And so as far as dentistry is concerned, a lot of people don't know a lot about it. All they know is that dentists are people that work in people's mouths. And some might find that interesting, some might not. Some have, personal experiences they can relate to as far as going to the dentist. Some good, some bad. And what I would say about dentistry, the career choice, is just keep an open mind, and it's more than just working in the mouth and drilling in teeth and dealing with oral health issues.
Mm-hmm. And most young people today are really centered. There are a lot of studies that suggest it's really centered on service, serving others. Mm-hmm. And that is kind of a theme in the millennial and the Generation X and Y and Z populations. One of the emphasis of A.T. Still University is about service. In fact, the most important emphasis is service, and we've adapted language, be the light of hope you wish to see in the world. You obviously had that passion for service going into dentistry because you're working in Indian Health Services. How does that make you feel to know that you're giving so much back to your community?
It makes me feel really good. When I decided I wanted to be a dentist, I wanted to be of service. I wanted to give back to my community somehow, and at the time that I was trying to make the decision of what I was going to go to and as a profession, I knew that at that time, I knew that at some point in time I would probably move back to the reservation. And so I was thinking about career options that I could have on the reservation. And the two things that came to mind at that point were, okay, if I'm ever going to move back to the reservation and get a job, then I will either have to go into healthcare and work at the hospital, or go into teaching and work at the school. Those are the two things that I thought that I could do and eventually do back there. So I feel pretty good about being a dentist and being able to give back, especially in the environment that I choose to work in right now. And it's been pretty amazing for me to treat people that are of my culture, my descent, my heritage. Even if we're not the same tribe and stuff like that, I get a lot of, are you Indian? Are you Native? And so that it already puts a lot of people at ease, already coming in for services that they get, which is, oftentimes in my line of field, public health is, emergency services. They're in pain, they've been hurting for a while. So it's a very good feeling to be able to give back and provide in a way I think that maybe not most people can provide.
That's really rich, and that's
Right.
Very interesting. There is a tremendous amount of research and studies with regard to health disparities and improving outcomes that suggest, more than suggest, they actually demonstrate profoundly that communities would be more served, particularly underserved communities, by those persons who are reflective of their heritage and background and experiences. I do want to get to a question that was asked earlier, though, regarding community service hours, and it was to the effect that how many community service hours would I need to get into A.T. Still University at the Arizona School of Dentistry and Oral Health. And I will say, before I ask you what your experiences were, I will say that our admissions department looks intently at the holistic view of a person. So there isn't, as far as I can tell, a set number of community hours. But what I have understood is that we look for a student who has that experience, who has the inclination to serve his or her community, and has done so in a more profound sense than just checking a box, and that those community service hours are relevant in the more modern, recent times, as recent as the application would be submitted. So to you, did you have any perspective with regard to, I got to have so many service hours, and these service hours need to be in such and such a place, or was that just innate in your evolution as a young person?
I guess I knew that there was the requirement that there needed to be some community service hours, and that there was this aspect of giving back to the community and basically not asking for anything of return, just be of service to something or someone or an organization or whatever. When you decide you want to be a dentist and you start looking into what the requirements are and what prerequisites are needed, and all of that stuff that it all entails, it can be very overwhelming. And when I decided I wanted to be a dentist and I started looking into it and everything, there are not very many resources at the time that I felt like I had available for me, and I didn't know how to ask the right questions. So I had always done community service. I think that high school you know, some of them required, and mine did. And so I already went in, and you know, you feel so good when you're able to give back, and nothing is asked of you other than just give your time. And so I kind of had kept that up a little bit when I came down to Arizona State University, and I volunteered a lot with the American Indian Institute program that is at the Arizona State University campus. And they do a lot of mentoring and outreach and stuff like that, and you know, donation drives and stuff like that for families in need and things like that. So I had already been kind of going along that route and doing those kinds of things. And when I decided I wanted to go to dental school, and particularly ATSU University's ASDO, and hearing about how much they look at what kind of service you provide, I started seeking out things that I could do. And so, you know, I just kind of continued along with kind of what my interests were. You know, I volunteered for the Boys and Girls Club, and I volunteered for a hospice program here. And, you know, I just kind of kept doing what I was doing and stuff like that. I tried to put maybe a little bit of an oral health spin on it. So when I was at the Boys and Girls Club, not only did I work with their little programs and things like that, but you know, I talked about oral hygiene instruction and why it's important to brush your teeth every day and all of that. And you know, it's rewarding in itself, and I think that it shouldn't be looked at as a requirement, but just the mindset you should get into, so that when you ultimately become a professional and a leader in the community, that you can just continue on with that.
Mm-hmm. I must say I knew the answer before I asked a question, because of your background experiences, that it was innate in your persona. And in fact, that is what the university looks for,
right,
is people like you who have that demonstrated that willingness to serve.